when Governor Romney talks about this board, for example, unelected board that we've created, what this is a group of healthcare experts, doctors, et cetera, to figure out how can we reduce the cost of care in the system overall. Because there are two ways of dealing with our healthcare crisis. One is to simply leave a whole bunch of people uninsured and let them fend for themselves, to let businesses figure out how long they can continue to pay premiums until finally they just give up and their workers are no longer getting insured. And that's been the trend line. Or alternatively, we can figure out how do we make the cost of care more effective. And there are ways of doing it. So at Cleveland Clinic, one of the best healthcare systems in the world, they actually provide great care cheaper than average. And the reason they do is because they do some smart things. They say, if a patient's coming in, let's get all the doctors together at once, do one test instead of having the patient run around with 10 tests. Let's make sure that we're providing preventive care, so we're catching the onset of something like diabetes. Let's pay providers on the basis of performance as opposed to on the basis of how many procedures they've engaged in. Now, so what this board does is basically identifies best practices and says, let's use the purchasing power of Medicare and Medicaid to help to institutionalize all these good things that we do. And the fact of the matter is that when Obamacare is fully implemented, we're going to be in a position to show that costs are going down. And over the last 2 years, healthcare premiums have gone up. It's true, but they've gone up slower than any time in the last 50 years. So we're already beginning to see progress. In the meantime, folks out there with insurance, you're already getting a rebate. Let me make one last point. Governor Romney says we should replace it. I'm just going to repeal it, but we can replace it with something. But the problem is he hasn't described what exactly we'd replace it with, other than saying we're going to leave it to the states. But the fact of the matter is that some of the prescriptions that he's offered, like letting you buy insurance across state lines, there's no indication that that somehow is going to help somebody who's got a pre-existing condition be able to finally buy insurance. In fact, it's estimated that by repealing Obamacare, you're looking at 50 million people losing health insurance at a time when it's vitally important.
Let's let the governor explain what you would do if Obamacare is repealed. How would you replace it?
Actually, it's a lengthy description, but number one, pre-existing conditions are covered under my plan. Number two, young people are able to stay on their family plan. That's already offered in the private marketplace. You don't have to have the government mandate that for that to occur. But let's come back to something the President and I agree on, which is the key task we have in healthcare is to get the cost down so it's more affordable for families. And then he has as a model for doing that a board of people at the government, an unelected board, appointed board, who are going to decide what kind of treatment you ought to have. In my opinion, the government is not effective in bringing down the cost of almost anything. As a matter of fact, free people and free enterprises trying to find ways to do things better are able to be more effective in bringing down the cost than the government will ever be. Your example of the Cleveland Clinic is my case in point, along with several others I could describe. This is the private market. These are enterprises competing with each other, learning how to do better and better jobs. I used to consult to businesses, to hospitals and to healthcare providers. I was astonished at the creativity and innovation that exists in the American people. In order to bring the cost of healthcare down, we don't need to have a board of 15 people telling us what kinds of treatments we should have. We instead need to put insurance plans, providers, hospitals, doctors on target such that they have an incentive, as you say, performance pay for doing an excellent job for keeping costs down, and that's happening. Intermountain Healthcare does it superbly well. Mayo Clinic is doing it superbly well. Cleveland Clinic, others. But the right answer is not to have the federal government take over healthcare and start mandating to the providers across America, telling a patient and a doctor what kind of treatment they can have. That's the wrong way to go. The private market and individual responsibility always work best.
Let me just point out, first of all, this board that we're talking about can't make decisions about what treatments are given. That's explicitly prohibited in the law. But let's go back to what Governor Romney indicated, that under his plan, he would be able to cover people with pre-existing conditions. Well, actually, Governor, that isn't what your plan does. What your plan does is to duplicate what's already the law, which says, if you are out of health insurance for 3 months, then you can end up getting continuous coverage, and an insurance company can't deny you if it's been under 90 days. But that's already the law, and that doesn't help the millions of people out there with pre-existing conditions. There's a reason why Governor Romney set up the plan that he did in Massachusetts. It wasn't a government takeover of health care. It was the largest expansion of private insurance. But what it does say is that insurers, you've got to take everybody.